So here are some of the current arguments for the inclusion of personality disorders in the insanity defense. So after the ALI had established the exclusion of antisocial personality disorders in the insanity plea, research has shown that criminal behavior is not the only manifestation of personality disorders, of specifically antisocial, and there are characteristics that are not associated with criminal activity. And this finding also offers explanation as to why there are people who have antisocial personality disorder who are able to follow the law. Additionally, currently the prosecution is able to use the diagnosis of a personality disorder for the basis of their argument, which leads to more adverse action on the defendant. So while the defendant might be able to control their behavior, they cannot control having a mental illness, so it is unfair to conclude they behaved criminally simply due to diagnosis of a personality disorder. And additionally, the use by the prosecution increases stigmatization of individuals with personality disorders without criminal behavior. So, in previous cases in which the perpetrator had a mental illness, it was often discouraged. It has been discouraged to try to use the insanity plea, as the consequence of involuntary commitment is longer than what their sentence would have been. And we would expect to see the same discouraged use of the insanity plea among those with personality disorders, and it would likely only be used in cases in which they have severe symptoms of psychosis or disturbances to reality. Another argument is that by separating those with personality disorders from the general population of criminals, it would allow for research on interventions to be conducted more feasibly and with greater knowledge of what kinds of therapy is effective. It could lead to a reduction in recidivism. And lastly, as I mentioned before, by excluding personality disorders, mental health professionals are tasked with trying to determine whether or not the insanity plea can be used, even if their mental impairments are not legally relevant.